Hello and welcome to our board film for September, which gives you an update of the key issues that we talked about at the Trust board meeting this month. It was really good this month at the board to welcome Dr. Rani Sophia and Sister Sharon Field from the FOPAS unit to come and give the patient's story to the board. And in fact they gave a couple of patient stories which described how the FOPAS unit, which deals with our frail older people when they come into the hospital either as emergencies or referred through from their GPs, how the unit's been designed specifically to cater to the needs of that particular group of patients in a much more calm and welcoming environment. The patient stories they gave really showed how important that unit is becoming in the care of the complex elderly patients for our local community. And there were some really good examples of how the team at FOPAS have worked not just with colleagues within the hospital, but very actively with colleagues in community services, primary care, mental health services, social services, to make sure that wherever possible, patients are discharged back home as quickly as possible, ideally on the day, with a clear plan of action and a care plan that can be followed through by community services. And it was great to hear such a good example of an innovative service that's been developed from within the hospital, but that's now beginning to outreach and get involved in some of the services outside the hospital, particularly with colleagues in primary care. In my report to the board, I was really pleased to be able to update colleagues of the improvement that we've seen in our annual survey of junior doctors. For those of you who don't know, our junior doctors are surveyed every year by the GMC as to the satisfaction they have for the training experience of working in the hospitals across the country. Last year, our performance increased significantly, with our junior doctors reporting an increase of overall satisfaction that was previously at 70%, that's jumped up to 81% last year. We've recently received our feedback from the Deanery on our results, and the Deanery commented on the significant improvement they've seen in the way we support and look after our junior doctors in their training programme. And we were really encouraged as a board to see that, because we recognise the important role that junior doctors play in delivering hands-on care to our patients every day across the hospital. But we're also really committed to continue to want to improve our relationship and our engagement and support for junior doctors, and the board are absolutely committed to looking at how we achieve and improve in our position from being currently one of the top 3 performers in the Deanery region to being the best performer in terms of overall satisfaction for junior doctors coming to undertake training here at Yeovil. I also gave the board an update on our 5-year plan that we submitted recently to Monitor, who are the regulator that oversee all foundation trusts. And we've been required to submit a plan to Monitor that sets out the key challenges for this organisation over the next 5 years, both in terms of the way we deliver services and also our finances, and how we believe we're going to tackle those challenges. We've got a very ambitious plan to look at how we can build and develop Yeovil Hospital as part of a local health and care system within the area. But we also acknowledge that the financial challenge facing the organisation is significant, and if we don't change and deliver a different type of service and work in a different way with our colleagues in community services, social care and with GPs, then we won't be able to develop a sustainable future for the hospital alone. So we're very much key part of our financial plan and service plan moving forward is to look at how we integrate services much more across the whole local health system. And really that's the key fundamental part of our 5-year plan, which we've described to Monitor. We've recently had the opportunity to talk that through with Monitor face to face when they came down and visited, and we've got a follow-on meeting with them next month to go through that in a bit more detail, and particularly to focus in on how the financial plans that we see going forward are going to underpin the way in which clinical services are redesigned and remodelled over the next 5 years, particularly to cope with the ever-increasing elderly population that the whole health and social care system is going to have to deal with. Tim Scull, our medical director, gave an update to the board on a new quality committee that's been established as a committee across the hospital to oversee the quality of the services we provide, to look at the clinical standards that we're constantly being challenged to deliver, but also to do individual look down into certain specialties or areas to make sure that we understand the clinical outcomes that are being delivered in the particular specialties, and that we're doing everything we can to look at how we improve the quality of the care we provide, and that committee is being chaired by Tim Scull, with colleagues from nursing, medical staff and other professional groups from across the organisation. Tim also gave an update to the board on some of the current challenges we have in medical staffing. We know that there are particular gaps in certain specialties with consultant vacancies or recruitment difficulties in certain specialties. And then we were able to have a conversation at the board yesterday about some of the challenges, that not just about the here and now, but also looking to the future about some of the challenges that certain specialties have nationally, recruiting people in to work in them, particularly specialties such as emergency medicine, acute medicine, some of the medical specialties, and really thinking through as an organisation about how we're going to deal with that and what we need to do as an employer to work in a more joined up way with the deaneries, with medical colleges, to think about how we can come up with potentially different types of roles, both for medical staff and other clinical staff, to really tackle some of the workforce challenges that face us in the future. Helen Ryan, our Director of Nursing, was also able to update on staffing with regard to nursing, and we reviewed all of our staffing levels across the hospital on a ward-by-ward basis at the board, which is a really important part of our role to make sure that we have adequate staffing levels within the hospital and that we're filling all of the shifts across the trust. I'm pleased to say that by and large we're able to fill all of our nursing shifts across the trust, but it's true to say that we recognise there are still some real challenges, particularly in nursing, with recruitment and filling vacancies. So sometimes it does mean that we're using bank and agency staff to make sure that we're filling all of our shifts, which we know isn't always the best thing to be able to do. We're just about to start a big recruitment campaign for staff nurses, and we've got a new recruitment manager who's joined us within the HR team, who's going to be working with Helen and some of the other senior nurses to develop a very proactive and positive campaign across the area and across the region to see what we can do to try and encourage and incentivise nursing staff to want to come and work here at Yeovil Hospital. Helen was also able to update the board and let them know that we've been shortlisted for a Nursing Times Award in the area of patient safety for the work that we've done on implementing the safety thermometer across the hospital. And again, this is a monthly event that the NHS undertake nationally, where we do a stock take on a given day of every single patient across the hospital, where the nursing staff go out across the hospital and understand what the quality of care is being provided to our patients, the number of patients that are currently at risk of falls, making sure that we've got appropriate strategies in place for managing that, checking medication, nursing note records, things like pressure ulcers. And the approach we've taken to it at Yeovil is a very proactive approach whereby senior nurses do that out on the wards, talking to ward staff, but then importantly come back and share their findings and also share the learning of what they've seen on the wards, so that making sure that rather than just doing as a stock take exercise which collects data, we're actually using this as a very positive way to engage on patient safety and talk about issues as a senior nursing team. And it's that process that's been shortlisted for the Nursing Times Award, and we should find out in October whether we've been successful at winning that award. Helen was also just able to update that we are in the final process now of selecting and recruiting a new head of midwifery for the hospital, and the interviews are happening today, the 18th of September, for the head of midwifery, and we have a very good field of candidates, so we're hopeful that we'll be able to make an appointment into this key strategic post within the midwifery workforce today, and that will obviously be shared with the wider organisation going forward. Tim Newman, our Chief Finance Officer, updated the board on our current financial position, and it's a very challenging financial position that we're currently facing within the organisation. We always knew that this year we were going to be in a particularly difficult place, and we projected that we would be in a deficit financial position by the end of this current financial year, which ends at the end of March. Currently, however, our budget position is that we are currently £2 million overspent at this point in the year from where we should be against our budget. Now, the primary drivers for that are twofold. First of all, we currently have a full escalation ward open, which we didn't have planned to be open at this time of the year. Bear in mind that normally the period between April and September over the summer is a time in which demand tends to be lower, and we tend to be able to manage without escalation beds. We've actually had to have our escalation capacity open throughout the summer, up to 30 beds, sometimes 36 beds, which hasn't been budgeted for this year. So obviously having a ward open over the summer months has caused significant pressure financially because it wasn't budgeted for, and it's meant that we've incurred significant costs in terms of temporary staffing for nursing and other things for that patient group that we're having to care for on that ward. So that's a big part of our financial overspend at the moment. And the second part of our overspend links back to the point I mentioned earlier about medical staffing. We're currently having to fill quite a number of vacancies across the hospital with temporary medical staff and locums, and obviously that again is quite an expensive way of having to resource those gaps, and those two factors are really the primary drivers in our current overspend in the financial position. We're working very closely to see what we can do to try and reduce our overspend, and also having lots of conversations with our commissioners to try and understand what's driving the demand for our services and what financially the commissioners can do to support us to manage the increased activity levels we're seeing. But also understanding that some of the reasons why we've got escalation capacity is also about our inability to discharge people out to community beds or at home with social care packages, which really reflect some of the financial pressures that are out there in social care and community services that are also beginning to have quite a significant financial impact on us as an organisation. So it's really important that we work collaboratively with our commissioners to try and get a grip on this financial position and try and get our budget back under control, because we need to make sure that our financial position is as in line with our budget as we forecast. Tim also updated the board on our new commercial director. You will know that we've got a number of commercial ventures within the organisation. Particularly, we have our private patient wing and the Kingston wing. We have our joint venture with Circle for ophthalmology services. We have a commercial venture for pathology with a private sector pathology partner. And we've never had anybody at a senior level coordinating that activity, but also looking at how we could develop further revenue streams and income streams for the organisation. So we've recently recruited Simon Lilly into the commercial director role. Simon joins us having been the director of marketing and sales at Flybe, the low-cost airline in Exeter, and brings with him a huge amount of experience and expertise in commercial development, and I think will be a real asset to the organisation. The board also reviewed our current performance, and overall the Trust is doing well despite the increased activity levels we're seeing in certain areas and some of the pressures that the system is under. A couple of areas that we did talk about, however, which are under particular pressure. First of all, our performance in cancer is still good, but we recognise there are some particular pressure points in the cancer services area, particularly around the breast cancer service, where we know we've seen an increased pressure, and particularly patients are sometimes choosing to wait a bit longer than the 2-week time frame for their initial consultation, which is posing a bit of a challenge to us in terms of performance. And also there are other pressures, particularly in specialties such as dermatology, where we're seeing a real increase in the number of people being referred through on the cancer pathway for dermatology, which is putting some real pressure on the system within that specialty, which isn't causing a major issue at the moment, but the board were just keen to understand some of the risks that may be around that. We also talked about the wider referral to treatment time performance, which overall again remains relatively good, but we have agreed locally with our commissioners that we will have a focus over the past couple of months to get our referral to treatment times improved further, and particularly that relates to orthopaedics, where we still have some pressures with waits for patients over 18 weeks, which is the national standard, and we're doing a lot of work actively with our commissioners to look at what we can do to reduce our waiting time in orthopaedics further. Should also say that this isn't just a Yeovil position, this is a national challenge. Waiting times as a whole across the country are being put under quite a lot of pressure at the moment, and actually our organisation is performing very well when you benchmark against other organisations across the region. In our final part of our board meeting, we were fortunate enough to have colleagues from Monitor, the regulator of Foundation Trust, to come down from London to give us a presentation on some of the work they've been doing on the challenges facing small hospitals. Nationally, there's a lot of conversations going on about what the future of small hospitals are, particularly as the financial challenges facing the NHS become ever more acute. What was really interesting from the Monitor presentation from their work is that they found no direct correlation between the size of the hospital and the financial performance or the clinical outcomes, but they recognise that there are some particular challenges that face small hospitals, particularly those hospitals like us that serve predominantly rural communities. It was really encouraging to hear the feedback from Monitor, but also to hear that they are very keen to work with us as we develop our thinking about how the future of the hospital needs to be different and how we work in a different way with GPs, community services and social care to develop a new model of care for our local community. And Monitor were very supportive of this approach and feel that they want to work with us to also engage in that conversation to help their thinking at a national level about what the model of a small district general hospital needs to look like in the future. So it's really important for us that we have people like Monitor, our regulator, engaged and involved with us in those conversations moving forward. So overall it was a good board meeting and a positive feel despite some of the real challenges we faced, particularly on the finances. It's really good to be able to give this update to you about what we talked about, and as always, if you've got any questions or comments about the board meeting, please get back in contact with me through the Trust's email system. Come along to one of our Connect staff briefings next month to hear more or ask questions, or you can always channel any thoughts or communications back through the communications team. Look forward to updating you further after the October board meeting.